this evening. I don't know where you are. This is the first webinar of a series of webinars that we plan to do. And the idea is that, through this is we give a little bit of a snapshot of the situation of the country. And then also we tell partners the highlights of the situation analysis and the workshop. After that, it can follow, conversations, more one-on-one conversations can follow to look at the details. But we hope that this gives you a bit of an idea of the work that we've done so far in El Salvador. As you know, the ATOM Coalition doesn't have people stationed in the ATOM countries, but because we rely on UICC members that are experts in their country, that live in the country, and that they have a long trajectory of doing work in their countries, in El Salvador in this case. So we have Dr. Lisette Ruiz de Campos. She's a pathologist. She's the president of ASAPRECAN, a longtime UICC member, and she's been working in El Salvador with civil society, with the Ministry of Health in many, many different initiatives. So I'm going to give the floor to Lisette. She'll give a little bit of an introduction of the project, and then we're going to look at the results of the workshop, of the situational analysis and the workshop. So Lisette, the floor is yours. Thank you.
Thank you very much. Well, good morning, good afternoon, and good evening to all of you. It is a great pleasure to welcome you to this important session. I would like to begin by expressing my heartfelt appreciation for your presence and for the generous support you continue to provide to our effort in El Salvador. My name is Lisette Ruiz de Campos, President of the Asociación Salvadoreña para la Prevención del Cáncer, ASAPRECAN, and focal point for the ATOM Coalition in El Salvador. I am honored to open this first webinar in our new series of country-focused sessions. Today, we will lead you through the progress of our national program of work, including key outcomes from our recent prioritization workshop. This workshop, held on March 4 and 5 of this year, was a pivotal milestone in laying the groundwork for effective project implementation. It brought together a diverse group of stakeholders, including representatives from the Ministry of Health, the National Regulatory Agency, the Social Security Institute, the Central Storage Facility, and technical agencies such as WHO and PAHO. We are deeply grateful for the strong engagement, constructive dialogue, and spirit of collaboration that characterize the discussion. These exchanges have been instrumental in shaping the priorities we will be sharing with you today. I would also like to acknowledge the invaluable technical support for our ATOM Coalition partner. A special thanks to Bart Osh from the IDA Foundation, Megan Sheridan from Direct Relief, Ines Garcia and Jacqueline Montúfar from the Max Foundation, and Doctors Dan Milner and Gilberto Lopez from the ATOM Coalition. Your guidance and participation in this workshop were truly impactful, and I look forward to hearing your reflection during this section. My sincere thank you as well to my esteemed colleague, Dr. Joaquín Celarié and Antonieta Anaya, for their outstanding leadership in data collection process. Their commitment and precision have been essential to our shared progress. I also want to recognize the core project team from the Minister of Health Non-Communicable Disease Department. Your leadership, dedication, and vision were fundamental to the success of this initiative. I am truly proud of what we have accomplished together and the strong foundation we continue to build. Lastly, I wish to express my deep gratitude to three exceptional women, Melissa Rendell Garcia, Ana Cabanes, and Sumi Krishnamurti from the Atom Coalition country supporting for their invaluable contribution and unwavering commitment. Thank you very much, Ana and Sumi. Today's session has two main objectives. One, to present the national context and priority areas identified through our recent workshop. And two, foster a collaborative and inclusive dialogue with all of you, valued partner. We move into the implementation phase. Your insight and feedback are not only welcome, but essential. Together, we can take meaningful steps to improve equitable access to cancer medicine in El Salvador. With that, it is my pleasure to hand the floor over to my colleague, Dr. Ana Cabanes, Senior Technical Advisor for Country Support, who will guide us through the background, context, and technical takeaway from the workshop. Thank you again for your time, your partnership, and your unwavering dedication to this vital mission. Thank you very much. Now,
Thank you,
this is
Lisa.
the National Theater.
Beautiful. Thank you, Lisette.
Okay.
Thanks very much. Could you stop? Fantastic. Okay, so thanks, Lisette, for this introduction. I am going to proceed now to give you a snapshot of the work that we've done in El Salvador since we launched and since we signed the MOU with the Ministry of Health. Just to remind you of the steps, the coalition, the Atom Coalition, signs an MOU with the Ministry of Health of El Salvador in this case, because we really want to work with the main with national strategies within the national cancer control plans. So for our countries, the countries that we take this systematic approach, we sign an MOU. Then we do situation analysis looking at 4 different areas: regulatory processes, supply chain, pathology and diagnosis, and then appropriate clinical use. We'll look at what is the current situation, and we then, through a workshop, we identify the barriers. We look at the data that's been collected, we identify the barriers, and we come up with priorities, or, I think it's better to say that the national stakeholders come up with priorities that then are ranked in order of what they think that should be addressed earlier or later. We're going to talk today only about the top priorities and the key findings of the situation analysis, but we do have a lot more data and we do have a lot more priorities identified. So we can continue the conversation later, but for today, we're going to just give you a high-level view of the findings. So next slide, please, Sumi. So a little bit of context. The provision of cancer services in El Salvador is decentralized, and there are 2 main bodies. One is the Ministry of Health, and the other one is the Social Security Institute. The Social Security Institute covers public sector workers and family members, and people pay into that Social Security Institute. And it offers also, in addition of healthcare, it offers pension and other economic benefits as well. Between these 2 bodies, these 2 main agencies and NGOs, there are 14 main centers that provide treatment for breast cancer. And I just want to remind you that we at Atom, we decided to focus on breast cancer because usually it's one of the cancers that is more common in most of the countries we work, which is the case of El Salvador, but also because we use breast cancer as a tracer malignancy. And if we set up the system or processes to address breast cancer, we believe that then adding other cancers is much easier. So that's why you'll hear some You'll hear a lot about breast cancer during this webinar. The patients can, this is a interesting, patients can seek care across different care facilities. That is that they can move from the public, from the Ministry of Health to the Social Security Institute if they pay into the Social Security, and then, but they do it depending on the geography and sometimes convenience or availability. So that complicates a little bit the follow-up of the treatment and forecasting and so on. About, in general, as a number, about 70% of breast cancer cases are treated. So 70% of the diagnosed of the people diagnosed with breast cancer, they follow up with treatment. And then we have 20 out of 21 essential medicines for breast cancer are often or always available. Next slide. The situation analysis, we're going to now quickly review the findings of the situation analysis. There was established, so El Salvador has established regulatory capacity. They're classified ML2, and there is appropriate funding for review and registration of medicines. The pricing follows international benchmarks. There is the laboratory capacity is just at the beginning, and registration processes can take up to 4 months. One thing that came that seemed to be, people seem to agree during the workshop, is that even though regulatory processes are not perfect, there are no big issues, and whatever barriers they are, the government and the people that work in these agencies, they're already trying to improve that. The second, in looking at the pillar of supply chain forecasting and supply chain, the group identified that there was advance, there is forecasting, but there are delays. So methods for forecasting are not standardized and vary across institutions. There is some digital infrastructure, and there is relatively well established in supply chain, but there is a lot of, here it says, unregistered demand, which impedes forecasting precision. That means that there is a lot of unnoticed, or that we really don't know the demand, the real number of cases that they're being diagnosed, and that really doesn't help the forecasting. There are delays in receiving medicines. This is something that came up then, so there are multiple public tenders at play for the same medicine. And the stock out rates for essential breast cancer medicines is between 0 and 25%. So there was a good discussion, and we have here in the webinar, we have Bharat and Megan, who led the discussion in these two different areas, and they can tell you more. But I think that in general, people were, I wouldn't say satisfied, but they understood that, or they thought that regulatory and supply chain were areas that were being they were being improved, and they had some issues, but they were okay. Let's put it this way. Next slide, Sumi. The other two buckets or discussion points, one, pathology and diagnostics and appropriate clinical use. Most of the discussion focused on these two areas. And this is something that varies depending on the country. My impression, I think that in El Salvador, there was a lot of focus on these two areas rather than in the regulatory and supply chain. So regarding to pathology, there are no guidelines, and so people use guidelines, but there is no harmonization among or between facilities. There is no systematic approach to reporting, and that somehow affects the screening, diagnosis, and referral. We have that only 16% of the cases are diagnosed at stage 1. The main cancer biomarkers are always available in facilities, although for diagnosis, out-of-pocket payments are common. The hospitals, as I said before, they use different screening and reporting formats, but all the data is trying to be collected at a national registry with some more or less success. Most facilities have ultrasound and fine needle biopsy capacity. So it's more about the harmonization of the guidelines and reporting of the pathology results. With regard to the appropriate clinical use, because the care is decentralized, there are different levels of service precision. And again, we have the same problem here. The facilities use international and evidence-based guidelines, but there is no agreement or there is no harmonization among all the facilities that treat cancer in El Salvador to use one. So there is a diversity of guidelines that are being used. As I said before, breast cancer is one of the top cancers in El Salvador. The breast and prostate cancer, they represent 30% of the new cancer cases, one in women and one in the other one in males. The patients wait up to 12 weeks to begin treatment. And sometimes it's difficult to ensure continuity of treatment and availability of medicines since the patients can move between different care facilities. And then it's really hard to estimate and to also to track these outcomes. Next slide, Sumi. Thank you. Okay, so those were the snapshot of the issues the most relevant issues that we found from the situation analysis. The priorities that people identified during the workshop and that they think that are the most important to be addressed are the following. This is the way we did this. We had discussion time during the workshop. We identified the priorities and then we asked people to rank them through an automated system through Menti during the workshop. We also, because we knew that since we had teams in which the leaders of the teams and the people that worked with these persons were in the same room, we felt that we needed to run also an anonymized survey after the workshop, just to make sure that people can speak up with confidence, that there is no pressure to just agree on what the leader of your team does. So we have these two kind of methodologies to really try to get a true sense of what people think should be addressed in the first place. So in regulatory affairs, there is a need for strengthened budgeting and monitoring to reflect oncology expenditures. So the budget and the needs, the cost or the amount of money that's needed to address, to provide certain cancer services, they don't really match. There was interest in strengthening the national supply of biosimilar and generic medicines. So they really want to promote the local manufacturers of biosimilar and generic medicines, and they established a methodology to prioritize the drug listed in the national formulary. This is within the regulatory affairs. In supply chain management, there is interest in strengthening hospital-based cancer registries, because this is where the initial problem for forecasting starts, when the data that you have, it's not reliable. And again, the second point was ensure that medicine's forecasting is based on treatment data and not in historical data, maybe epidemiology data or some other estimations. And thirdly is to improve interoperability, to integrate cancer within clinical electronic systems. There was a lot of talk about that the systems, really, there's some digital systems already already in place, but they don't really speak to each other, which is also a common problem in a lot of different places. Next slide. With regard to pathology, and as I said before, here is where most of the discussion took place. The priorities were to strengthen radiology and pathology human resource capacity for pathology, particularly for technicians, for pathology technicians. There is no formal training for them. There is, so people learn as they are in the job, and people are doing this job well, and they've done it for a long time, but there is no formal training for that. So this was one identified as one need that it would be important to resolve. Appropriate budget allocation and innovative financing models to improve diagnosis. There was only one facility in which the pathologist can actually has the mandate to, or can forecast and can procure the amount of reagents and products that he needs in his department. The other ones, they're basically not even asked. They're, estimated by some third parties or people that are not really doing the work. So kind of bringing that capacity to, letting the pathologist in the main hospitals to really forecast and procure, that would be of a lot of help. That was identified as a priority. And then if we really want to, there is a need to strengthen prevention, early diagnosis, and screening that really cannot come detached from improving pathology and diagnostic infrastructure. So people thought that really that is an important piece to tackle, if particularly because the prevention, early diagnosis, and screening needs to be really reinforced in the country. With regard to the appropriate clinical use, the unification of care protocols, the guidelines, that is the harmonization of guidelines that was brought up over and over again, and strengthen the cancer registries and interoperability of the systems, which is already, you will see it now that it's already into place. I have to say that a lot of the discussion that occur, and Bart and Megan can also talk about that. We felt that there were the two systems were present. Ministry of Health and Social Security were present at the workshop, and we felt that a lot of maybe that we discussed a lot the Social Security and not so much the Ministry of Health, and Social Security is the system that has more resources and works a little bit better than the Ministry of Health. So I think that some of these that maybe we would have to go back and drill down into some of the Ministry of Health. I don't know, maybe really look at the difference between the two systems, because they might have been that by being together, we kind of we didn't emphasize enough the needs of the Ministry of Health. But I'd like to hear from my colleagues also if that it's true. Next slide, Sumi. Thank you. So since the workshop that was in March, this is what the country has done already. Cancer registry is underway. It integrates data for the last 5 years across all facilities. So there is already a national initiative to really kind of improve the data collection systems or the hospital registries to really kind of provide the data to a national cancer registry. There's also patient navigation project that has started, led by ASAPRECAN, independently from the ATOM coalition. But ASAPRECAN, our Dr. Lisette, is working with the Ministry of Health and with the Social Security, and they have developed a training program for patient navigation. So working with a university in El Salvador, so they can provide that more structured and formal training for patient navigation. And then we already seeing that the availability of medicines, it's a question that, or it's an issue that is rapidly raising in the political agenda, and financing being brought to the fore. In fact, the economic team at the Ministry of Health, they're looking at, they're really taking a comprehensive approach to look at the expenses and budgeting and so on, and economic analysis of the Ministry of Health and the medicines and the cancer medicines. Next slide. Well, and those are the next steps. So this is all I wanted to present to you today. But I just want to say before we start with the discussion, the next steps is that we'll send you an expression of interest form that will be shared with all the partners, and that has all the priorities that I presented today, plus the other ones that I didn't present here today, but that were also discussed during the workshop. And the idea is that you look at that list and see where your organization has interest, has expertise, has the willingness to help the coalition work
Hoi, hoi.
on
Hallo. Ja, je had het verhaaltje gelezen.
Yeah, could you
Ja, ik moet even zoveel
mute
mogelijk doorsturen. Ik
yourself?
zit in een
I think,
internationale vergadering trouwens ondertussen hoor, maar ik heb hem even nog
or could you mute
stilgezet.
yourself?
En,
Or Sumi, can you mute him? Okay. Okay, thank you.
ja, het eerste wat er dan gebeurt is altijd dat hij op de speakerphone gaat, hè? Maar dat wilde ik inderdaad even doen.
We're going to have bilateral calls to assess the partner, your willingness and capacity to support. So after this webinar, you're going to get the expression of interest, a list of priorities, and then look at that list, and then we can have bilateral calls or group calls to assess what could we do in El Salvador together. We hope that we can start implementation in Q3, so during the summer or right after the summer. And we're going to have in July a similar webinar about Zambia, about the findings, which were completely different from El Salvador. So I think it also gives an opportunity to the partners to see that really just doing this situation analysis, we already can see different areas of focus on in each of the ATOM countries. So with that, I'm going to open the floor for questions and discussion points, anything you feel like asking to Lisette, to Sumi, and myself. Thank you very much. So I'm not sure that I can see people's hands. So maybe you just speak up if because I'm not sure that all the attendees fit in my screen. Comments, questions?
Yeah, perhaps I can go first. I think during the workshop, it was nice to have both the ministry as well as Social Security together in one room. And I think we also found that just the fact that we were talking about the same topics with that group was kind of unique. It was a new opportunity that didn't happen too much before. And I was wondering after the workshop, did we see more of that continuing interaction between the various groups? So has the workshop already kind of initiated a new kind of level of collaboration between those parties? I'm not sure, Lisette, if you can shed some light on that. No, you're still muted.
I'm sorry.
Mhm. Yeah,
Repeat your
we can hear
question,
you.
please.
Did you hear the question, Lisette?
No.
Okay. So he is asking if there was nice to see Social Security and Ministry of Health working together during the workshop. Do you see have you seen continuity on this, or after the workshop they just went each one, continued working separately? So, ¿ves alguna colaboración
Sí,
desde el
ya,
workshop?
voy a hablar en español y tú me haces el favor
Sí,
de traducirlo.
sí.
Efect- eh, Estamos trabajando en conjunto. Estamos
Ujú,
trabajando en lo que se denomina Alianza Nacional para la Prevención y Control del Cáncer. Y este proyecto de ATOM se está trabajando con un grupo de coordinación a nivel país donde el Instituto Salvadoreño de Seguridad Social es parte.
ujú. So yeah, she's saying that actually, yes, that there is a national strategy that is they and that is that they have formed an alliance between the two systems. The Atom Coalition work is being, let's say, coordinated at the country level by a group of experts or a group of experts from both from the Social Security and from the Ministry of Health. Thank you, Lisette.
Oh,
Thank you.
yeah, that's nice.
So one other question, Bart. Did you feel that let's say that the successes of the Social Security can overshadow a little bit the the needs of the Ministry of Health during the workshop? Do you think we got clarity on what was different between the two systems, or that people spoke about national needs but without really specifying?
Probably not enough, but I loved to see that initial interaction that clearly was like a first for most people in the room. So the fact that they were actually gathered around the same topic with the same goals,
Mhm,
I was hoping was the start of kind of a new level of collaboration and
mhm,
kind of, well, a journey towards the common success.
mhm,
And so I'm pleased to hear that at least to some extent this continued also after the workshop, not so much on the decisions and the topics itself, but also on the
mhm,
collaboration between the various parties that are all essential to receive, well, to eventually reach the goals.
mhm.
So
Excellent.
yeah, I
Yeah.
saw it part of a process of coming together more than anything else.
Mhm. Yeah, excellent.
Yeah.
Thank you,
So
Bart.
I think there was one other topic that I, at least in my view, I perceived as something more difficult and so hard to talk about also in the workshop, and that was the topic of the out-of-pocket payments.
Mhm.
So we did not spend too much time discussing that element, and I'm not sure if anything happened after the workshop further on this part.
No, Lisette shaking her head, saying no,
No.
nothing has happened.
All right. No, but I think it's good at least to acknowledge that we kind of parked that a little bit.
Mhm,
But at least at the first day topics, this was kind of one of the things that clearly
mhm,
is still to be addressed at some point
mhm.
when the time is right.
Yeah.
Mhm.
Yeah, and the purpose of the situation analysis, we know that doing the situation analysis, we're not going to find everything, right?
No.
It is just to guide us to, it's what we are talking about. It's the process of getting people in the same room, discussing the
Mhm.
topics, having these country coordination team working together from both institutions. So obviously the work, not even the work, but the fact finding is not
Mhm.
completed, but it just
No.
guides us to where the workshop kind of guided us towards where we want to proceed or we need to proceed to get more information.
Yeah.
Thank you.
Yeah.
Thanks.
Yeah. This would be an element. After the workshop, I did some further traveling and talked to more to the patient side of it, who was basically not much represented in the room.
Mhm,
But clearly, the out-of-pocket payment levels is what is on the forefront of minds if you just think about the end customer, the receiving end, the patients and their family. So
mhm,
it is clearly an important topic.
mhm. Thank you, Bart. Thanks. More comments, questions? No. Is there a partner that maybe wants to talk and see if there's some areas of interest or things, maybe some comments, maybe something, maybe this kind of supports other findings, or they heard something completely different? No volunteers, I see. Well, I don't see a lot of you. I don't see everyone. But anyway, so if, we're happy to share we're going to be sharing the report, all the priorities, which are, it's, I don't know how many, but 50 or 60 priorities. Sumi says yes. So take a look at that, and then we'll reach out, or you reach out to us. It doesn't matter. I think that we just need to connect among, the secretariat and partners. And from Sean, okay, we'll do hold on. Let's see what everything say about the full report, but you just answered that. Okay, great. So yeah, Sean, you'll get the full report, and then we can have bilateral or smaller group conversations on, and really drill down into the specific questions that might interest you, or where you can provide some expertise. Last chance to speak up. Sean is on the train. We heard from him.
I can ask a question if I
There you go. Go ahead.
before it gets noisy. So LCell is one of the global platforms for access to childhood cancer medicines countries, one of the new six. Is there any review of how Atom's view might change as a result of that? Because that's only been recently announced.
Sorry, can you repeat the last? You were breaking up.
Yeah, sorry. So El Salvador is a member country now of the global platform for access to childhood cancer medicines. And
Yeah.
is there any consideration of reviewing what Atom is considering in the country because of that?
Uh-huh. So I'll ask
Perdón.
Bart.
Sí, perdón. El
Dale.
Salvador es parte de esta
Sí.
iniciativa.
Ujú.
Se está trabajando en ella y se espera que para finales de este año ya se pueda accesar completamente a la plataforma.
Uh-huh. So Lisette is saying that they're working on, so that Salvador, as you said, is one of the countries, the selected countries that they're working, and they hope that at the end of this year, that they can access the platform. Also, when we were in El Salvador, we know that already some results of that partnership, and maybe Bart can, Bart again, sorry to put you on the spot again, but we actually there was some oncologic medicines for pediatric cancer that already arrived to one of the clinics, an NGO that is attached to one of the main hospitals. And we actually went to see it. So Bart, that was a collaboration between the IDA Foundation and the Ministry of Health.
Yep, and
Am I-
Servier and brought together by Atom, I would say. So
Okay.
a very clear collaboration there in the ACT program. But it was fantastic to see the Children's Cancer Hospital that is basically independent and fully funded, and they have a fantastic reach with just about every child with cancer in the entire country is welcome and has access to full treatment at the center. The people who are running it it's heartwarming to see. They have dedicated their lives and are really giving up everything to make this possible and keep it possible. They're running for more than 50 years already. And they really are a fantastic partner in the ACT partnership to make this possible. So they were given access to a donation quantity of Servier for Pag asparaginase, and it's immediately saving lives, and the impact was dramatic. So that was fantastic to see. I was very, very pleased to see that in person, and actually it's hard to keep the tears in if you see the effect of what this brought.
Yeah. Yeah, thanks, Sean. Yeah, that is different. So Lisette answer you about the platform, and obviously, Adam, if will support that as much as we can. So there are no plans, there are no implementation plans since we're in this phase. But yeah, obviously, if that is a priority for the country, of course. Okay. So, super. That's Sean. Fantastic. So, thank you very much for attending this. I hope it was useful. So, if this was useful and you want to join us for the Zambia webinar in July, please do so, which you'll see a completely different outcomes in the priorities. So, you'll start seeing the different needs of the different atom countries. So thanks so much. Thank you, Lisette. Thank you, Bart. Thank you, Sumi, and the entire team. And we hope to have bilateral meetings as soon as possible, as soon as you have the chance to read the full report. Thanks so much. Bye-bye.